There's something profound that shapes the way we relate, and it's outside of our awareness. That is recent trauma. Recognizing the signs of trauma and understanding how trauma influences interaction will enable you to be a more effective therapist. Welcome to The Art of Therapy, Season 2, Episode 19.
Just to have a look at the previous episode, I feel like with the previous episode, we really covered a very meaningful and very nuanced aspect of therapy. And just the part that we looked at is that how most people, we want to feel accepted. We want to feel like we belong. And sometimes we may have the best intentions to do that, but sometimes our impact is different. And that our potential or how we elicit either acceptance or rejection from our social environment, what an important aspect that is to our mental health as well. And as soon as a therapist can identify that and understand that, actually how much it opens up and how much room it creates in the therapeutic relationship to assist a client with that.
Yeah, it's quite remarkable because, as we had touched on, a client is eliciting responses, reactions in the environment without knowing how come, why, and it's not intended. But it's incredible when one has a safe space, a therapeutic space, where a therapist will help you decode some of the reactions you're receiving and what you can do about it. So it's an amazing experience to just be in a safe, secure interaction, a therapeutic relationship where it's really genuine, it's trustworthy, there's deep understanding, it's accurate empathy, and where there's no judgment, where this can be looked at and decoded. It's quite amazing. And then sometimes how simply some of these aspects of the way we communicate, we can change them, modulate them, and how empowering and how meaningful that can be.
Yes, yes. Okay, so we said that the last time is that there's another aspect to it. And like we said, is that a lot of people come for therapy because they've experienced some form of trauma. And start to have a look at maybe first just what is trauma in this sense, that we have a look at that first.
Yes. Trauma is such an important consideration in therapy. And when we looking at trauma, what we're talking about is an experience that was deeply disturbing, deeply distressing, and where we were afraid of something, of some impact to us, of losing our own life or someone we care about, or something just deeply disturbing where it affected the way we see life, the way we see ourselves, the way we see someone we care about or others, that it is deeply disturbing. And that is experienced then in a very typical way, which many of us, regardless of how we relate and what we're busy with, if we go through such an experience, we tend to relate and react in a very similar way. And we can look at that in more detail perhaps in a moment, but the key consideration is, has someone had such an experience? And why this is important is if they have experienced trauma recently, because of the impact of trauma, it literally knocks someone off their feet. And the way they then can react, the way they relate, the way they communicate can be hugely changed, and very drastically so. And again, in ways that they don't intend to anticipate. They're just desperately trying to cope with trauma, this terrifying or deeply disturbing experience. That's what they're just trying to do. They're trying to survive. They're trying to cope. but they haven't realized the way they're relating, the way they're communicating is very different to the way they usually relate, the way they usually connect. And that can have an enormous impact in and of itself.
Yeah, I think this is something so important because it is trauma. You describe it. It really knocks someone off of their feet, and if a therapist is not aware that someone experienced a trauma, it can. The therapist might not understand their client, and for the therapist to understand to what degree does it actually affect how someone relates, how they behave, how their communication is that it really has it can have a very big change in how you assist a client. And it is trauma it's a terrible experience.
Deeply disturbing. Yes. As you've just highlighted the way that it can impact, and it's so important to understand this, because if we just pause for a moment, if any one of us, if anyone experiences trauma, we so often experience it not exactly the same, but in similar ways. First, we're just so terrified. We try to push it away. We try to not think of that terrifying experience. But very often we know the more we try to push it away and the more we try not to think about it, the more it comes up. So it tends to come up more and more. So that's just such a normal reaction, to try and just get that terrifying thought out. Think, not just get it away, don't think about it. And then we know that there are going to be other reactions. We may, for instance, have flashbacks where we're just busy with something and we literally relive some aspect of that terrifying experience. Or we may find that we have generally slept well, but now we're having nightmares that are very vivid, very frightening, very disturbing. Or if we just see something that reminds us of that experience, we just immediately feel a great anxiety or fear. Also, we know with trauma that as we try to push it away, there's another part of our mind, subconscious, that's busy with that experience. And so if we generally are more focused, we're concentrating, we may find that as we're coping with trauma, we're not concentrating. We're distracted. If we've got a high capacity to be empathic within the context of trauma or coping with it, quite often someone can become very impatient, irritable. They're just relating in ways that are they're just trying to cope with the very distressing experience, trauma, but it's significantly affecting how they relate and the reactions that they in turn are eliciting.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za. Really, it's in that moment of trauma where it's very active trauma, where it changes how we relate, how we behave, what we do. And it's like you say, sometimes we get impatient, sometimes we isolate.
Yes.
Someone that might have been very social and connecting might just make their world smaller and smaller, but just trying to cope with this tremendous impact of the trauma.
Very much. They're just trying to cope. And yet there are all kinds of changes in the way they're relating. As you noted there, they may isolate themselves, whereas usually they connect, and now they are withdrawing. And this can go on for some period of time. As someone just withdraws, isolates. Maybe there was something terrifying about that experience, or they're deeply disturbed about how they responded. Maybe they were embarrassed or ashamed or disappointed in how they responded. And now to express it, they feel ashamed, or they're going to elicit rejection. So here they are just withdrawing more and more, as those around them working harder and harder to try to be there, support them. But meanwhile, there's something very disturbing here, and it totally may change the way they're relating. So it can just happen. It's reactive. It's a reactive trauma. They're just trying to cope. So for one person, it may be isolation. For another, it may be that, we spoke about the nuance of control in relationships. Someone may have been very balanced with that. But we know with trauma that one feels so overwhelmed, so powerless, that very often the first thing we want to do is try and get some assembly of control again. And so here's someone who's now traumatized. They don't realize it. They've suddenly become very prescriptive, very controlling. And this is going to have, secondary impact or effect on the kind of support they get or the way people are responding to them. So, trauma is something that we react to, and it can have an enormous impact on the way we relate, and even our preferred ways of relating and interacting. And that's why it's so key for a therapist to recognize this and contextualize that where there is trauma, part of how they're reacting and relating and interacting may be a direct consequence, actually, of a very painful, unresolved trauma.
I think it creates so much clarity, because it puts it into context as well, because like I said, trauma affects how we relate and how we interact with others. But if a therapist doesn't recognize the trauma that a client is going through, they might work on all of the other aspects, but it's not their client's preferred way of how they relate, how they usually engage.
Yes.
But it's actually the trauma. So once the trauma is looked at and assisted with, then maybe all of those other things might fall back into place
beautiful.
again.
That's exactly what very often does happen. As someone begins to recognize, I'm actually traumatized, or this experience had a huge impact on me, and I can understand now that my reaction is a normal response to an abnormal situation, and I'm going to be okay. And there's a working through. Very often, as they work through that trauma, or in the process, it all since resolved it, their preferred way and their meaningful ways of relating, connecting, interacting, just sort of naturally, organically, just continue and resume.
Yes. I feel like within this series we've covered so much and so many details of different elements that has an effect on our mental health. And so I think just now what I'm sitting with is, what next? How does a therapist look at all of these things together, and what do they do with it?
Yes, we've looked at a number of different nuances around interaction and how we relate. And each one in and of themselves can be profound.
Yes.
The question, though, there is, well, we've learned to see a number of these nuances, and exactly how do we put that together? How do we make sense of it? And how do we distinguish of some of these nuances and interpersonal qualities what may be particularly important? What's especially relevant for the therapist to look at? Or what feedback one can, as a therapist, note that there are several things where a client could really benefit from feedback. But again, the principle is not doing it in an overwhelming way. A client's got to learn and understand themselves and their way of relating, and be able to express this to those around them in some way that's meaningful. It's not too much. So which nuance will we look at first? What's important?
Yes.
Yeah, so it's to understand how this all fits together.
Yeah, it seems like as soon as we have that, it really makes a difference. I feel like
Yes.
there's a lot of them that we've gone through they all play such an important aspect, but it's their knowing what then and where and how.
Indeed.
Yes, yeah. So maybe that's something that we can have a look at in the next episode.
Yes, I think that's essential.
Thank you for joining us on the Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.